As you know, I'm Dr. David Beaulieu, and I'm here with more news you can use. I want to introduce you today to one of the practitioners in our office, Ross Smith, and he brings emotional freedom technique to the practice. We refer to that as EFT. Ross, how long have you been doing EFT?
I've been doing EFT since around the beginning of 2012.
Okay. Now, you're originally from Joplin.
Mm-hmm.
All right. What got you into EFT?
My wife had a breast cancer diagnosis, and her holistic MD recommended you for a part of her wellness journey.
Right.
And while we were investigating or trying to find your office location on the internet, and we came across some websites that talked about EFT, and it was very interesting to me, so I started pursuing some knowledge in that field, and I went ahead and started the certification process in EFT.
That's an interesting story, and you've been busy with EFT pretty much ever since.
Yes, when I first got interested in it and started gaining knowledge and going through the certification process, I did my own. I tapped on myself and tapped on my family and tapped on my friends. So had a lot of experience and have clients now as a result of that knowledge that I've gained.
Okay, now you've talked about tapping on yourself and tapping on friends and learning to tap. What's this tapping all about?
Well, tapping is indeed just another term, probably a more generic term for EFT, but EFT is, I've heard it described as acupuncture without the needles.
Yeah.
And that's a pretty simple description, but I think it's more involved than that, to say the least. We are energetic beings, and we have energy systems called meridians in our body, or pathways for energy. And there's points along these pathways that you can tap on that go into that actually I'm getting off what I'm saying here. These
that actually activate energetic mechanisms.
Energetic mechanisms, yes, they activate energetic mechanisms and help you clear energy blocks and emotional blocks.
So we're pretty much focusing on behavior. We're pretty much focusing on a patient's attitudes and prior thoughts and, if you will, baggage, contributing to the physical dilemmas that we get into, bringing us into a doctor's office.
Mm-hmm. Yes. And we know that emotion oftentimes is what's behind even physical pain. So, and our mechanism in our body, the part of our brain called the amygdala, is the fight or flight mechanism in our body. And that amygdala gets activated, and it sends out chemicals into our body that cause us to go into the fight or flight mechanism. We either want to fight or we want to run, one or the other. And that mechanism is good if you have a dog chasing you or you got a runaway car coming at you. That's a good mechanism. It shoots those chemicals into your body and gets you ready immediately for to run or to fight. So that's a good thing. And then after the event is over, whatever it is, our system quits putting out the chemistry. We settle down into a normal state, and everything is okay. But the problem is that it's not a problem, but it's a fact that we as human beings are thought-making machines. We think all the time. It's reported that we have somewhere between 50 and 60,000 thoughts a day, and those thoughts can be affirmative and positive and life affirming, or they can be negative and life depleting. So those thoughts are something that we have all the time, and if they are negative and fearful, our amygdala or our subconscious doesn't know the difference between an actual event and a thought.
I want to stop you right there.
Okay.
Because I think that this is an important topic area, and I'd like to explore it in our next video.